Hello and welcome to Ethics. The topic of this first lecture of the course is on Judith Jarvis Thomson's excellent article called The Trolley Problem. So the first thing I want to say is that this article is intended for an audience of professional ethicists. It's written at a very high level. It assumes a lot of background knowledge in the field of ethics. And part of the reason why I'm having you read it first is so that you can get a kind of idea of what an endpoint looks like, of what really good, high-quality moral reasoning looks like, so that you can sort of carry that with you and work toward it. And so I realize that to some extent I'm throwing you into the deep end, and that's fine, but know why I'm doing that right off the top. So the second thing I want to bring up before getting into some of the substantive issues with the article is that if you haven't read the article yet, stop now and go back and read the article, then take a look at the lecture. The lectures cannot in any way replace the actual activity of thinking through a written article. Good philosophy, good reasoning tends to happen at the speed of reading and writing, much less at the speed of talking and listening. And so the best I can do in these lectures is do a little bit of outlining, do a little of highlighting, do a little explaining. I can supplement the text. I cannot replace the text. The text is the main event, and I want there to be absolutely no ambiguity as we go on about that issue. Okay. All right, so the first thing I want to do in talking about the trolley problem, assuming you have read the article and read it very carefully, well, I guess before I get into that, the first thing I want to do is introduce something about the author of the article itself. The author of the article, The Trolley Problem, is here photographed in several different photographs over the course of time. This is Judith Jarvis Thomson. She lived from 1929 to 2020. She died in late November of 2020, so that's pretty recently by the time of this recording. She was a tremendously influential moral philosopher, having written some very important articles, actually more than one of which you'll get to read in this course. She received her PhD from Columbia University in 1959 and spent most of her career teaching at the Massachusetts Institute of Technology. So that's there you go. That's Ms. Thomson. And so I wanted to start out by asking a few questions. One of the things that people tend to struggle with in a course like this one is what they're supposed to be looking for when they read one of these pieces, right? Because again, I'm sort of throwing you to the wolves right away. The reading is complicated, the ideas are complicated, and so it can be difficult sometimes to figure out what to really look for. And so I want to give you some sense of what sorts of things I would be expecting out of a student who'd read this and was trying to know it well enough to prepare for something like an exam. And so here are the kinds of things that you might would, for example, turn into exam questions on a piece like this one. So first off, notice the title. Titles are a very important thing, right? Don't skim past titles and think that they're unimportant. They're usually very important, especially in philosophy, where we try and make it the titles as matter of fact as possible. And so the title of the piece is The Trolley Problem. Okay. I think it would be very bad if you read a whole piece, as long as it is, about the trolley problem and were unable to answer correctly the question, what is the problem in the trolley problem? Okay, that would be sort of the main focus of the article. And this is something I think this is a question that I think is very easy to get wrong. Because of confusing a couple of different things together. Okay, but I'm going to go through some of the questions before we start talking about some of the answers here. Okay, does the difference between killing and letting die make a difference? All right, why or why not? Okay, that's a very important issue addressed in the article. You'll want to be able to explain that. Notice in philosophy, we're very much interested in a lot of these why questions. Okay, less interested in this first part here. I mean, this is a simple yes or no. The answer is no, according to Thomson. The important thing is, why does she think that doesn't make a difference? If rights are the most important thing, morally speaking, how must we respond to Thomson's cases? Okay, that's another very clear question there. if utility, right, the greatest good, is the most important thing, morally speaking, how must we respond to Thomson's cases? Okay, another important question there. And finally, what are you supposed to do when your feelings about what is moral contradict a good moral principle? Right? It's a very much a subtext of the entirety of this article. So a good thing to focus on if you read it. So if these aren't the questions you anticipated when reading it through the first time, you might take another look, right, to see what might you have missed. What would have led you into thinking that there was some different major focuses. And of course, those aren't all possible questions that would come out of an article like the Trolley Problem, but those are some good examples. Okay. All right. So let's start off by talking about how one of the first things that the article introduces, something called the trolley driver case. Right? And it goes this way. Every time you see quotations here in the notes here, these are quotations from Thomson's article in this case. So she writes as follows. She says, suppose you are the driver of a trolley. The trolley rounds a bend, and there come into view ahead 5 track workmen who have been repairing the track. The track goes through a bit of a valley at that point, and the sides are steep, so you must stop the trolley if you are to avoid running the 5 men down. You step on the brakes, but alas, they don't work. Now you suddenly see a spur of track leading off to the right. You can turn the trolley onto it and thus save the 5 men on the straight track ahead. Unfortunately, there is one track workman on that spur of the track. He can no more get off the track in time than the 5 can, so you will kill him if you turn the trolley onto him. Is it morally permissible for you to turn the trolley? Okay, so that is the trolley driver case. Now, Thomson herself did not invent such a case. The first time trolley cases were used to illustrate things about ethics was in an article by another ethicist by the name of Philippa Foot. But in the time since Foot proposed this as an example, they've been widely used. And Thomson here in this article makes sort of great use of such cases. So what you want to do is when you read a case like this one is stop and think very carefully about what you think is morally permissible and what isn't. And again, more importantly, why? Okay. So one of the things you might wonder is you might say, well, I mean, this seems to be a horribly tragic thing. Why not give the track workmen rocket packs and then they can get out of the way of this train? Or why not have it all just on flat ground where they can just get out of the way? Or why not have a backup set of brakes on the train? It's like, well, of course, all of these things are important, and engineers have to think about safety, and that's always a good idea to imagine what could go wrong and how people can avoid harm when things go wrong. But that's not really the point of this particular example. If we fixed the example so that nobody was threatened by anything, it's all of a sudden not a very interesting puzzle about ethics. And so one of the important things about thought experiments is to just take them as they're written, because the point is not to say, oh, imagine this circumstance. It's to say, we're going to construct this circumstance so we can say something important about morality, about ethics. Okay, so take the example as it's written. That's really the point of all this. So here's a kind of illustration, right, of a kind of trolley case. This, of course, doesn't have the valley she describes, but it does have people sort of tied down. It serves the same function, right? So there's the trolley driver with the option of either turning the trolley onto the one workman with the result that you will kill them if you do, or you can let the trolley go and kill the 5 instead. Right? So there you go. There's a case. Now, what's interesting is that this here is not actually all that problematic. I think it's pretty obvious that you're saying, okay, well, look, I'm facing a situation in which one person could be dead, or in which 5 people could be dead. 5 dead seems quite obviously worse than 1 dead, and so of course it's morally permissible to turn the trolley. And if you're thinking that way, you're thinking the way that pretty much everybody thinks when you're looking at this case. The case itself is not particularly challenging. Okay, the trolley case. And so it's really only half of the issue that Thomson wants to bring up here. Thomson also wants to bring up this doctor case. It's another hypothetical case in order for us to say something interesting about ethics. And so again, this is a quote from Thomson. I'll go ahead and just read it out. She says, or she writes, "Now consider a second hypothetical case. This time, you are to imagine yourself to be a surgeon, a truly great surgeon. Among other things you do, you transplant organs. And you are such a great surgeon that the organs you transplant always take. At the moment, you have 5 patients who need organs, 2 need 1 lung each, 2 need a kidney each, and the 5th needs a heart. If they do not get the organs today, they will all die. If you find organs for them today, you can transplant the organs and they will all live. But where to find the lungs, the kidneys, and the heart? Well, the time is almost up when a report is brought to you that a young man who has just come into your clinic for his yearly checkup has exactly the right blood type and is in excellent health. Lo, you have a possible donor. All you need to do is cut him up and distribute his parts among the 5 who need them. You ask, but he says, "Sorry, I deeply sympathize, but no." Would it be morally permissible for you to operate anyway? Now, again, think about this case. This is another case that's not particularly difficult, right? Just imagine that this is, that you're this person here, and someone says, "Oh, it seems totally fine to cut you up for your organs." Again, the vast majority of people looking at this case will say, well, quite obviously, you can't just, go cutting up people against their will, no matter how much good you can do with their organs. That's simply a violation of someone's rights or some such reasoning there. So again, this case itself is not all that challenging, just like the trolley case is not all that challenging. So this is where we get the actual problem. So the trolley problem and the trolley case are not the same thing. The problem that Thompson is talking about is that these 2 cases, the trolley driver case and the doctor case, have very sort of opposite conclusions, even though when you look at them side by side, it seems like we shouldn't have opposite conclusions. Okay. So again, imagine we've got this, this sort of doctor here. This is just a stock image of a doctor. This is probably clearly an actor, not an actual doctor. I say that only because it sort of looks like a standard TV actor. Maybe there are, doctors out there that look like TV doctors, but probably not very many of them. In any case, just as a side note for reasons of nothing, if you look at the way that this particular doctor is wearing the stethoscope, with sort of over the back of the neck, with the sort of the earpieces on one side and the listening piece on the other. That used to be a way you could tell television doctors from real doctors, right? A lot of television doctors would sort of wear a stethoscope in that way when they weren't using it, and real doctors would tend to sort of have the earpieces behind the neck, so it looked a little bit more like a necktie. But in about the 1990s, when some of the actors in the cast of the television show ER wore their stethoscopes in sort of this fashion, people thought it looked cool enough that a lot of real doctors now wear their stethoscope in that fashion when they're not using it. So again, it's no longer a reliable test as looking at how they wear the test. So anyway, this is the example visually represented. Okay, so here then is the trolley problem, right? If and Thompson writes that if you think that the answer to the doctor case is much clearer than the answer to the trolley case, feel free to call it the doctor problem instead of the trolley problem. It doesn't really matter. The problem is that almost everybody thinks it's permissible to turn the trolley, and almost everyone thinks it's not permissible to operate on the patient, and yet those 2 beliefs appear to be inconsistent, right? And the reason they appear to be inconsistent is because they are inconsistent, okay? These things cannot both be true. Right. So either when you're faced with the situation of the trolley problem, either it's, the reasoning that you use says, look, 5 dead is worse than 1 dead, so you turn the trolley. Okay. Well, notice you could apply that same reasoning just as well in the doctor case and say, look, 5 dead is worse than 1 dead, so you operate on the patient. On the other hand, you could say, well, look, it clearly violates the rights of the patient to just operate on them for their organs against their will. And so, applying that argument to the trolley case means, well, I guess you can't turn the trolley away from the 5 and onto the 1 because that violates a person's rights against their will. And again, neither of those solutions seems particularly appealing. So what's going on? How are we going to proceed from here? Okay, so again, this is the trolley problem, right? So this is the problem is that these two cases are at odds with each other, despite the fact that they really ought to have the same answer. Okay, so let's consider some of the reasoning here behind each of these kinds of verdicts. Okay, and so I'm going to outline this in terms of a couple of moral arguments, and you'll see we'll talk a lot more about moral argument and the way that works in subsequent lessons, but you know, I'm going to start how I aim to proceed here. So here's the argument. Okay, here's the set of the reasoning that leads to this. All right, we have this first premise, okay, that says that given two options, it is at least morally permissible to choose the option with the most benefit and the least cost. Right? That's a kind of principle of the greatest good. What matters is what happens when you do something. What matters are the overall consequences, in other words. This second premise here is that turning the trolley and having the doctor operate both have the most benefit and the least cost of the available options, right? So if you're counting people being alive as better than people being dead, the one solution to the trolley problem that winds up with fewer dead is turning the trolley. And the solution that leads to fewer dead in the doctor case is operating on the one patient to save the five. And so the conclusion, given these two points of reasoning, if you combine these two claims, see where they lead us here to the conclusion that turning the trolley and performing the operation are at least morally permissible. Okay, and that flies in the face of what we would normally say in the doctor case. And so that's the problem with an argument such as this one. And so the result, though, if you look at that argument, is that on pain of incoherence, you either have to accept that it is permissible after all for the doctor to operate, or else you've got to say that the greatest good principle is not a good moral principle after all. You have to pick one of those options, right? Either that first premise is false, or else the doctor really should operate, right? It's at least morally permissible for the doctor to operate in the doctor case. Okay, so pick your poison there. On the other hand, you could argue using something like this rights principle here. So here again we have a first premise, right, that it is the idea that it is always morally impermissible to violate a person's rights. Okay. The second premise is that turning the trolley violates the rights of the one who would not otherwise be in danger, that one person on the track. And performing the operation violates the rights of the patient. Okay. And so if you, again, put those two ideas together, you get, very solidly this conclusion that turning the trolley and performing the operation are both morally impermissible. And so that flies in the face of the way that we ordinarily want to approach the trolley case. But again, on pain of incoherence, you either have to accept that it is impermissible to turn the trolley, or else that you have to say that the rights principle is not actually a good moral principle after all. Again, that is, you have to say that premise one is false. It is not always wrong to violate someone's rights. Neither of those options seem particularly good. So again, pick your poison. And so the question that Thompson turns to in after presenting these difficulties is trying to find a way out. And there are really two possible ways to escape this conundrum, this idea that you either have to accept an implausible idea about one of those two cases, or else you have to deny some really plausible sounding moral principle. Okay, so number one, you could show that the doctor case and the trolley driver case are not, after all, morally equivalent, right? You could show that, in other words, that there's some difference in those two cases that explains our different attitudes about them. You might say they only look like the same case, they're not really the same case, right? You could do that. Or else you could say find some moral principle other than the rights principle or the principle of the greatest good that would give you, in a sense, the right answer in each of those cases, right? Something that would tell you, yes, you can turn the trolley from the 5 to the 1, and you can't operate on the 1 to give their organs to the 5, right? So that's those are options, right? And Thompson's going to look at each of those options. So let's look at the first one first. This is the proposal. The proposal is that a distinction between killing and letting die will get us out of having to answer the trolley case and the doctor case in the same way, right? So again, that would show that they're not really the same case, and so it's okay for us to have different answers to each of those cases. And so the way that this works is that you say first, okay, perhaps it seems that the trolley driver kills 5 if he does not turn the trolley, and kills 1 if he does. So he should turn it because killing 5 is worse than killing 1. Right? And that might make sense. And then you say the doctor case is different. It's not killing 5 versus killing 1. It's letting 5 die versus killing 1. Right? That is, the doctor lets 5 die if he does not operate, and kills 1 if he does operate. So since killing 1 is worse than letting 5 die, then he may not operate. So this is a good attempt, right? This is a good attempt at making these two cases look sort of different. And on the face of it, it looks like it should be successful. Thompson's not so sure this is really going to work. And so part of her point is that if we really, if these cases really aren't parallel, well, then we should use our imagination a little bit till we come up with cases that are parallel and see if they still give us our problem. And so again, if the cases are not the same in every morally relevant way, then they can't really do their job, which is to test our moral principles. And so instead of the trolley driver case, consider the trolley bystander case instead, right? And this, again, is a quote from Thompson's article. I'll go ahead and read it off. She says, in that case, the trolley bystander case, you have been strolling by the trolley track, and you can see the situation at a glance. The driver saw the 5 on the track ahead, stamped on the brakes failed, so he fainted. What to do? Well, here is the switch which you can throw, thereby turning the trolley yourself. Of course, you will kill 1 if you do. Now notice the difference that the trolley bystander is in versus the trolley driver. The trolley driver, in deciding not to turn the trolley and drive onto the 1, is in fact driving onto the 5. Right? And so it really is a case of killing 5 versus killing 1 if you're driving the trolley. The bystander is not by any means in the same position. The bystander is in a position where if they do nothing, nature takes its course. They had absolutely no role in the trolley being in any particular place. They have no responsibility for what it does, unless they involve themselves in the cause and effect by which it does whatever it does. And so that means that choosing to flip the switch will kill 1, and choosing to do nothing will let 5 die. So here's a visual representation of more or less the sort of thing that Thompson's talking about here, again, with persons tied to the track, right? So in flipping the switch, you are turning the trolley or actively killing 1 person. In doing nothing, you are merely letting 5 die, right? Letting nature take its course in some sense. And so now, just by changing the case a little bit, we see our problem is repeated. Right? The trolley bystander lets 5 die if she does not pull the lever, and kills 1 if she does. The doctor, again, remember the doctor case, lets 5 die if he does not operate, and kills 1 if he does. So now both cases are cases of letting 5 die versus killing 1. And again, it does not really seem like any plausible moral principle should allow us to decide the morality of one of these cases different from the other, and yet we really think that these cases are pretty different. Again, if you just ask most people, they say, well, of course the doctor can't operate, and they look at this, the trolley bystander case and say, well, of course the bystander could throw the switch. I mean, it would save 5 at the cost of 1, right? And again, with much the same reasoning as we've seen before, right? So that doesn't seem to get us out of it. However, say that you disagree that the bystander is only letting the 5 die if she does not pull the lever, right? I mean, that's a thing you could argue. You could argue that, oh no, that's still killing 5 versus letting 1 die, because if you see the situation, that inaction is itself a decision, right? You might make that kind of an argument, or else you perhaps are not sure what to make of the relative importance of killing versus letting die. Maybe killing isn't worse than letting die, right? Or something like that. So if you want to avoid that whole issue, you could simply consider a different case, right? And this is what Thompson suggests as another way to go. So instead of the regular doctor case, consider the mistaken doctor case. And again, this is a quote from Thompson, and I'll read it out. She says, "The surgeon was badly overworked last fall. Right? Some of his assistants in the clinic were out sick, and the surgeon had to take over their duties while dispensing drugs." Now, again, this is the whole point of this is to be an ethics thought experiment. Really, it's not surgeons that dispense drugs; it's clinical pharmacists that dispense drugs in hospitals. But whatever. Okay, so it says, while feeling particularly tired one day, he became careless and made the terrible mistake of dispensing chemical X to 5 of the day's patients. Now, chemical X works differently in different people. In some, it causes lung failure, in others, kidney failure, and in others, heart failure. So these 5 patients who now need parts need them because of the surgeon's carelessness. Indeed, if he does not get them the parts they need so that they die, he will have killed them. Okay, so think about how this works. And again, visual representation. I says, look, if I don't kill you, I'd be guilty of killing 5 other people. He says to you whose organs he wants. Right? And again, something just seems wrong about this. So again, we're left with the same kind of problem. If the reason that the trolley driver can turn the trolley is that killing 5 is worse than killing 1, then the mistaken doctor can operate because killing 5 is worse than killing 1. And if the mistaken doctor can't operate, then neither can the driver turn the trolley. And so, again, now we have a case in which it's killing 5 versus killing 1 in both cases. So again, we can make minor changes to either the trolley case or the doctor case that will end up making it apples to apples once again, and we still have very different ideas about but the most plausible way to approach those cases. So something's got to give here. And so perhaps we could try the second way of getting out of our trouble. Maybe this whole killing versus letting die thing isn't going to make a difference. It's not going to get us out of the problem that we have here. This problem, of the trolley case and the doctor case having very different outcomes, despite the fact that they ought to have the same outcome. Perhaps we should consider a different moral principle, something other than the rights principle or the greatest good principle. And so Thompson tries out one for size that seems like it might work, and she calls it the Kantian principle for reasons that you'll see later in the course when we discuss Kant's moral theory. But basically, this principle is going to be as follows. Do not ever treat people like things. That is, don't ever use people as a means only. That seems like a pretty good moral principle. After all, some of the very most morally wrong things we can think of, think of things like murder or rape or slavery or things like that, really, really seriously morally wrong things, all seem to have in common that they sort of treat people like things, right? They substitute your own will for the will of somebody else. That's bad. That's very bad. So again, it seems like a reasonable moral principle. And so again, if we want to apply it to our cases, it seems very clear that the doctor uses his healthy patient to save the 5 who need organs, while the trolley bystander does not use the one on the track to save the 5, really. Okay, and so maybe that's a way in which the cases are different, or that's a way a moral principle can make sense of our different ideas. And so the idea is that maybe we say the doctor can't operate because it would use the patient, but the bystander can pull the lever because they don't use the one on the track to save the 5. Well, this pattern should be familiar to you by now. Thompson asks you to consider then a different case. So instead of a lever and a side track, consider a straight track with a footbridge over it. On the footbridge is a very large person, right? In the article, she talks about a fat man, right? If this seems too much like sort of body shaming a hypothetical person to you, that's fine. Other writers using similar cases have talked about, for example, somebody wearing a very, very large, heavy, sturdy backpack that they would not be able to unstrap themselves from easily, or something like that. Anyway, so again, this large person. It's very clear to the bystander on the bridge that the large person's mass would be enough to stop the trolley from continuing on to kill the 5. So the question is then, is it morally permissible to push the large person off of the bridge? So again, visual representation of what's going on here. It's very much like the bystander at the track case, except that, we've changed the architecture a little bit. And again, that tends to really change a lot how people tend to feel about the case. So the idea is if in pushing this large person over the edge, they would have enough mass, right, to stop the train before it kills the 5, then essentially what you would be doing is sacrificing 1 to save the 5. Very much the way that the bystander at the track does it. In fact, just the same way that the doctor would do the same thing, sacrifice 1 to save the 5. And now all of a sudden, people tend to feel very differently about the issue. So that's something I certainly want to mention here. There's a big difference between psychology and ethics. Okay, psychology is, as you will later learn, a descriptive study. What psychology is concerned about is what is it that people actually think, right? And to some extent, perhaps, why do they think so? In ethics, we're going to be approaching morality from a normative perspective. We're going to be concerned with what people ought to think, right? Whether they do or not, right? And why they ought to think so. As in a kind of justification, right? Psychology wants an explanation for what people think. We want a justification for what people ought to think, right? It's a very different thing here. So this is the result, though, of a psychological study about cases like the Footbridge case that you saw pictured on the previous slide. And so the authors of the study did was they basically surveyed people as to how morally comfortable they are with a variety of these different kinds of setups. And so in the standard Footbridge case, the idea is that someone would would push the large person off of the bridge with your hands. You would shove them over the bridge so that they stop the trolley and save the 5. Okay, and of course people asked, is that morally permissible? Right. The Footbridge pole case is where you would push the person off of the bridge with a long pole. Okay, you've got a long pole, you could sort of, nudge them over, push them over the edge of the bridge with the pole, not with your bare hands. Okay, the Footbridge switch case is where you open a trap door that's in the thing by using a switch while you're standing beside the person. Okay, and then the remote Footbridge is where you would open a trap door with a switch while watching from a distance over a camera. Right. And you'll see that this is the way that each of those cases were, sort of subjectively evaluated by people answering these questions. You'll notice there's some real differences in what people tend to be morally comfortable with. It doesn't seem like physical contact is really the thing that makes the biggest difference to people. It doesn't seem like whether you're standing next to him or not standing next to him makes the biggest difference. The difference is whether you sort of use personal force, that is, use your own 2 hands versus just use a switch to flip a trapdoor. But frankly, if you want to, again, these things make psychological differences, but when you really think about it, it seems pretty clear that they should not really make any moral difference. Right? So the fact that people feel differently about these cases doesn't mean the cases really are different. And so you really have to start making a distinction between how certain cases make you feel and what the relevant moral features of those cases are. And so the point is that if you're willing to condemn someone to death by pushing a button, pulling a lever, or letting go of your tiger's leash, then you ought to be willing to push that person off of a bridge with your own 2 hands. Okay? The specific means of killing the 1 to save the 5 is morally irrelevant. So despite the fact that people often feel like there's a difference, that difference cannot be a matter of morality, right? That's the sort of thing that psychologists study, is how people's ideas differ as a matter of fact, or what explanations there might be for the reason that people's ideas differ. In ethics here, we're going to be looking for what's the right thing to do and why, and come up with some reason for that. It's a different approach entirely. And so again, we have the problem repeated. It seems reasonably clear once you think about it that the bystander at the switch case is morally equivalent to the bystander on the bridge case, right? Flipping a switch to turn a trolley and flipping a switch to drop a trapdoor. If it results in somebody dying, morally equivalent, okay? And so the bystander on the bridge clearly uses the large person to save the 5 in the same way that the doctor uses the healthy patient to save the 5. So either, again, both actions are permissible, or neither one is. Right, so introducing this new principle, this Kantian principle of not using anyone as a means only, doesn't get us out of our problem either. We still have a doctor case where people say, well, no, you can't just sacrifice one to save the five, and you have this sort of bystander, case, or if you want to call it the Footbridge case, where you say, well, no, I mean, look, it's, at the end of it, you have one person dead as opposed to five, So again, making a minor change in the case just repeats the problem. And so Thompson does, of course, go on, right? And what she has to say in the rest of the article beyond this point is absolutely worthwhile. It's absolutely great reading. But here we can stop and focus on some important lessons to draw from this particular piece. One of those lessons is that if something is good or bad, morally speaking, it is so for some reason. Okay, there has to be some kind of moral principle involved. There has to be something that makes it morally good, morally bad, morally impermissible, or morally impermissible. And it's really good to know what those reasons are and how they interact with certain other various kinds of cases. All right, so that's going to be something that's going to be very important to us, is figuring out what reasons we have for saying that things are morally good or morally bad, etc. In cases like these, like the ones that Thompson describes, either the principle is genuinely inconsistent, in which case we have to replace it with a better one, or else our judgments are mistaken, in which case they must be changed. Right? When you're dealing with a true case of moral conflict, like Thompson describes here, then we're faced with, again, one of two things, right? We either have to change our moral principles to try and replace them with better ones if they really are simply inconsistent, or else we have to change our judgments, right? Change the way we feel about, or the way we would initially react to certain cases. Maybe you have to change your mind about the trolley case, maybe you have to change your mind about the doctor case, or maybe you have to change your mind about which moral principles are really good ones if they lead you into this apparent inconsistence. And if your feelings are inconsistent with some good moral principle, well, so much the worse for your feelings. Okay? In the end, ethics is hard, and you cannot do it without running the risk of having to change your mind.